we spoke right at the start of the pandemic, and you were aware that the number of people who would be looking to reach out for help potentially would be on the increase. And actually, a year on, the stats have borne that out, and we have seen an increase in people reaching out for mental health help.
Yeah, it's always a bittersweet thing when we're looking at the statistics of use of the Hub of Hope, because on one hand, it's brilliant that people are seeking help, that people are recognizing that they need help and are looking for the help and support that's out there. But at the same time, it's testament to the struggles right now that more people than ever are having to reach out to find the help and support, to try and get that support right now, which often isn't always the case and isn't always possible to do. So yeah, it's good that people are using the Hub of Hope now, but at the same time, it just shows just how many people are actually struggling.
And in terms of sort of people thinking, well, maybe it's just a fluke or maybe it's a one-off, you can actually go through stats and dates which show that people specifically reach out for you around those key moments of the pandemic, particularly those sort of all-important press conferences that we saw right at the start of the pandemic.
Yeah, right at the beginning of this, when the Prime Minister first announced the lockdown, we saw a 248% increase in a day of people who were looking for that help and support, people who were hearing that news and thinking, this is going to affect me, this is going to have a dramatic effect on my mental health, and I don't know how I'm going to get through it. And when those numbers came through and we were aware of them, we did expect maybe that it would drop off. But right now, there's so many different milestones almost throughout the last year where people are almost trying to get better, trying to recover, trying to deal with things, and then there's another knock, there's another knock, there's another knock. And what we're seeing constantly, each time those knocks happen, each time there's something new in the news or a press conference, people are looking for that help and support to try and get them through to that next stage.
And in terms of sort of where people are reaching out to, your network of charities and organisations, they've had to find new ways of working throughout this pandemic as well. And it's testament to their hard work that they've been able to continue to provide a service.
Yeah, I have to say every single organisation that we've spoken to in the last year have adapted incredibly quickly to be able to help people. And that's something that we have had to face as a challenge ourselves, in letting people know that help and support is still there. Just because you can't necessarily go to the places that you would usually go to, because you can't see the people physically that you would usually see, doesn't mean services aren't there. Services are still there. Help and support is still there. It may be a little bit different, but it's still there and still available for you. So as I said, it's really good that people are seeking that help and support, but we just want more people to know that that help and support is available for people if you're struggling.
We've got the Behind the Mask project up and running at the moment, which is encouraging people to share their stories. The idea that we've all been through this together, but of course, all our stories are different. Are messages, do you think, starting to get through that actually there is a mental health issue very much associated with the COVID-19 crisis? It's not just a physical risk from a virus. The mental health threat is particularly real.
I don't think there's ever been a better time to drum that message through to people, that things out of your control can affect your mental health, and how vulnerable we all are when it comes to our mental health. Right now, I'd say the majority of people in the UK have struggled in some way, shape or form with their mental health. That doesn't necessarily mean that a lot of people have become unwell, but a lot of people have struggled to get through the day, to find the things to be able to help them cope. And as I said, there's no better time than right now for us to get those messages across to people. Everybody has mental health. Things are going to affect our mental health. And if we feel that we can't cope, we need to be reaching out for that help and support that's around.
What would you say to those people who've taken part in Behind the Mask and shared their stories, some really powerful stories, many of which have never been told before?
I'd thank everybody who has done it, because some of the stories that you're seeing, as you said, are unheard of. We all are struggling in our own way and it's very easy for us to be almost lost in that day to day because we're not seeing people, because we're not hearing from people. And having a campaign like Behind the Mask and being able to hear from people is really, really important for everybody right now. Not only to hear somebody else's perspective, but also to know that you're not alone. If you are struggling, if you find it hard to cope, if you find it all overwhelming, sometimes it's really hard to imagine anybody else feeling that way. And so it's important to hear from other people, to hear different people's perspective, to know you're not alone, they're not alone, and together we can all get through it.
And if a conversation with a loved one or a friend or a work colleague is not enough, the Hub of Hope is always there for people wherever they are across the country to type in a postcode or use the location on their device to find services that are open and that are open to a conversation today or tomorrow.
The Hub of Hope can be the start of your recovery. It's quite as simple as that. We are the biggest and most comprehensive mental health signposting tool in the UK, and we're growing by the day. What we exist for is to give people options of different types of help and support. It doesn't have to be a one-size-fits-all approach. There's thousands and thousands of support networks out there, and we just want to have them all in one place. So you don't have to think about where to go. You just go and find the help.